Hey, what's up guys? Welcome back to the nursing channel. It's your boy Sam. Hope everybody's having a good day today and everybody's staying safe. Make sure you guys take the necessary precautions so that you guys don't get contracted with the coronavirus. It's spreading rapidly. There's always new cases surging up every day. So please guys, make sure you guys are safe and you guys take the necessary measures to remain safe. Anyways, right now I'm gonna talk about my experience as a med-surg nurse. So when I first started off my nursing career, my first job that was offered to me was a medical surgical position as a floor nurse. And as a med-surg nurse, I actually enjoyed it. I had a lot of patients that I got to interact with, a lot of families that I got to meet, people of various cultures and backgrounds, and had some good times, man. I'm not gonna lie. I remember hanging out at the nurses station with my coworkers, just cracking jokes, sharing our nursing stories, talking about how bad C. diff smells and which patient, had C. diff, and try to limit your exposure in that room. And I remember just, talking about our gruesome stories while eating food at the same time. And it was good times, man. Like, I'm not gonna lie. You really create a bond with your coworkers. And sometimes, those same coworkers will help you out when you're wiping a patient's butt or turning them every 2 hours so they don't get pressure ulcers on their back. But anyways, overall, my med-surg nursing experience was not bad, but there were a lot of days as a med-surg nurse that I didn't enjoy, primarily because as a med-surg nurse, you're taking care of 5 patients, and a lot of stuff is going on with those 5 patients, and it's only one of you, right? You got a patient over here complaining of pain, that they want more pain medication, their pain level's 10 out of 10. Then you got a patient on the other side saying that they want a sandwich, that they're still hungry, or they want an ice cream bar. Then or they want more Jello. Then you got another patient over here who's being discharged and is eager to go home. Their family's waiting and they want you to get them prepped up so they can go home, pull out their IV. Then you got another patient over here who needs wound care and needs to get pre-medicated prior to that wound care. They need pain medication. Then you have another patient here who's being admitted to you. And you need to admit the patient, make sure you take their vital signs, get all their admission information, and get them settled in a hospital bed. So all of this stuff is going on. Not to mention families calling for the patients, asking, why is my family member getting this IV antibiotic? Or why is my family member on these medications? Or why is my family member not getting this medication? He was taking this medication at home. Why did the doctor stop it? So you're getting all of these dynamics all at once. And remember, it's just you alone. So as a med-surg nurse, you need to realize and you need to learn how to prioritize. What's more important? What's less important? And what can I leave? What task can I do later? What tasks should I do now? And that's where your nursing knowledge and your clinical experience and everything that you learned in nursing school, that's when that kicks in. All right, let me think about the body systems, the respiratory system, the cardiac system. Those things take precedence over wound care. Those things take priority over helping a patient up to the bedside commode so that they can poop or defecate. So that was really my experience as a med-surg nurse was rough. Don't get me wrong, I was good at my job. I had a lot of patients that would thank me and were super appreciative with the care that I provided. However, I did not truly enjoy my job as a med-surg nurse, because I felt like I was just tasking and tasking. Not really, I felt like I didn't really have time to interact with my patients, be able to get to know them, talk to them. It was just like give medications, take vital signs, assess them, and then go to the next patient. Take vital signs, assess them, give their medications, admit the patient that's coming on, discharge this patient, communicate with the patient's family members so that they know what's going on with their loved one, getting doctor's orders changed, clarifying doctor's orders, keeping an eye out on lab values so that, you know, I don't give a patient Lasix and their potassium levels are already low, and then the Lasix drops their potassium levels even lower and making them at risk of having a cardiac event. So that was my whole med-surg experience in a nutshell. Even though it was rough, I do appreciate my med-surg experience and the knowledge that I gained from it, because I feel like it gave me a really good foundation as a nurse, and I feel like I can venture into other areas and be able to bring this clinical knowledge that I obtained and transfer it over to another nursing or clinical area. So anyways, that was my med-surg experience in a nutshell. I hope you guys enjoyed this video. Like it. Please don't forget to like and support my channel. Don't forget to subscribe if you are a new viewer to this channel. So anyways, hope you guys stay safe. Take care. I'll see you guys later.